We all need to talk to people who are referring patients to us, because at times some of these people referring patients to us, even if they're social workers or discharge planners from hospitals, or even the physicians, they are not even fully knowledgeable of what is acceptable for home health patients. What are the qualifications for them to become patients? In addition to that, they even feel that some of the basic things are covered by home health agencies. There are physicians out there that believe that we can actually service patients for only a couple weeks just to provide IV therapy for the patient. If the patient is only requiring a couple weeks of services, they are not qualified to be home health patients. So we need to be able to fully educate them on what the qualifications are for patients to be admitted as a homebound or home health patients. When you get patient information, you want to ultimately be able to speak to the referral sources. You want to be able to talk to the physicians regarding how the patient is doing, whether the patient is improving, and especially when the patient is having problems. To be able to communicate properly on the care of your patients will always be a good thing. Also, understand this. Follow up with referral sources if you did not admit a certain patient. If there is a patient that was referred to you and ultimately upon assessment you find out that the patient does not qualify for home health services, follow up immediately with the discharge planner or the physician or the social worker that actually admitted the patient with you. Because you want to be able to explain to them why you could not service the patients. Do you know how many home health agencies that I have met, or marketers or administrators, do not follow up with these referral sources? And for the reason that they did not follow up and explain to the referral source that they did not admit the patient, they make themselves look bad, because when the word comes back to those discharge planners that you did not admit the patient and you did not tell them, the patient or the family did, because they were not properly educated, then there's going to be a problem. Then more likely you are going to lose that potential referral source. So make sure you always follow up with everything that you do. I always believe that in order to get more referrals, in order to get more ideas, always make sure you guys brainstorm with your staff. You'll be surprised how some of your staff who you felt does not know much would actually be able to come up with a great idea on how to be able to get into new markets and to be able to get more referrals. So make sure you follow up with referral sources, but also make sure you follow up with your staff to see if they have any advices that you can use in order to gain more referrals.